Hi, good morning everybody. It's Leanne Boyd from Fearlessly Free Women, and this time we're going to have another edition of Cuppa Courage Tips on vitamin D. There's been so much banter around this little vitamin, particularly with COVID vaccinations and how COVID may not be severe if you've got enough vitamin D. So let's talk about vitamin D today and all the benefits that it can bring to you, and what happens if you have a deficiency. We'll also talk a little bit about the vaccinations and also all the foods that you can get it from. So we're going to do vitamin D inside and out. So let's get going. So these days there's more and more research about the importance of vitamin D and its importance in our overall health. One of the reasons is the sun provides our vitamin D, and 95% of our vitamin D comes really from casual sunlight, and particularly these days with it's all being locked down and in lockdown, we're not getting a lot of sun. And also we've been told for many years, smother ourselves with sunscreen and to guard against skin cancer, which is a valid point. I've also had skin cancers removed, so yeah, I'm right on board with that. However, we do need sunlight, at least 10 to 30 minutes a day to be able to have that sunlight synthesize on our skin and do great things in our body. So right down from elderly people to adults to children and even infants, breastfed infants, we all need a certain level of vitamin D. So what is vitamin D? Okay, so it's a soluble vitamin that's present only in small amounts and in certain foods. Most of it comes from the sun, as I mentioned before. It's considered an essential nutrient. And it's an essential nutrient for the reason that our body can't produce it on its own. We need the assistance of food and sunlight to be able to get vitamin D into our bodies. So calcium and vitamin D are two important micronutrients that work together in our body. The complex vitamin D and calcium relationship is especially crucial when it comes to our bone metabolism and keeping our bones nice and strong and healthy, particularly as we get older and also as women going through menopause and losing our estrogen. It's just critical for maintaining the strength of our skeleton. Our body skeleton is what holds us up. Otherwise our bones go really soft. Okay, so together calcium and vitamin D, they support a healthy heart and an immune system as well. So I'm just going to go through an overview of how vitamin D is made and what it does in your body. Okay, so we as humans evolved to spend most of our time outdoors, and then the body converts sunshine into chemicals that are then used in our body. Okay, in particular, when UVB sun rays land on our skin, a substance called I'm just going to read this one because it's a long name, 7-dehydrocholesterol is literally converted into vitamin D3. So that's the more active form in our body. Okay, so this 7-dehydrocholesterol, or the cholesterol in our skin, if you like, it's similar to the cholesterol that we regularly hear about in our bodies. So it converts to pre-vitamin D and makes it more usable in our body as vitamin D-C, or cholecalciferol, if you like. And that travels through our body. It's sometimes called a provitamin D. So provitamin D travels through our body into our kidneys and liver, into our bloodstream, and then it's converted into calcitrol. Okay, so vitamin D actually becomes a hormone in our body. Okay, so let's go on to the benefits now. So the benefits of vitamin D are, wow, there's just so many. And I'll also go through the deficiencies as well. So here's some of the ways that vitamin D can support our body. So first of all, it contributes to our bone health. So vitamin D plays the role in the calcium absorption in our body, in our bones, and it works with a parathyroid hormone, okay, to maintain our calcium levels. Additionally, it has an effect on other important vitamins in our body and minerals too, to contribute to our overall health, including magnesium, vitamin K, and phosphorus. Okay, vitamin D is partially responsible for maintaining our phosphorus levels in our body, in our blood. And it affects calcium. And since it affects calcium to bind to proteins, it's believed it's also linked to the vitamin K as well. So as I said before, low levels of vitamin D can lead to softening of the bones. You heard of rickets, osteoporosis, and experiencing multiple fractures or broken bones. So that's what you may have. If you've broken a bone, the first thing they do is send you off for a bone density test and test all those levels within your body. So particularly in elderly, it's very important. So you have improved muscle strength if your vitamin D is at optimum level, and you're less prone to falls because you're stronger, and so therefore you have less injuries. So when levels are low, the parathyroid becomes overactive. Okay, so this is known as hyperparathyroidism, and the results end up in a drop in the phosphorus. Okay, so phosphorus, in addition to the calcium and other compounds, are needed to properly mineralize our bone density. So it plays a very important role in our bones. So it supports our immune system, and this is where it's come up a lot. The vitamin D is mentioned a lot these days due to COVID and what's going on in the world today. So exposure to UV light changes inside the human body. Okay, as I mentioned before, our human cells contain receptors for vitamin C when it's synthesized on our skin, and it's shown vitamin D to benefit our overall immune function in several ways, including preventing long and prolonged excessive inflammatory processes. So emerging research shows that this vitamin helps healthy cell replication and plays an important role in protecting against the development of autoimmune conditions. So you've got things like multiple sclerosis, even lung disorders. So there's evidence that humans need a certain amount of vitamin D in order for macrophages in our skin, in our blood, the white blood cells, to attack pathogens and do their job properly. So vitamin D seems capable of helping to strengthen our immune system by decreasing the ability of some viruses to replicate and grow. So I mentioned before with COVID, but it's just not COVID, it's all viruses. It's been shown to enhance the expression of enzyme called ACE2, ACE2, which is believed to have the ability to protect against acute lung injury. So thenceforth the COVID thing again. So because it can control inflammation, it may also benefit people from chronic diseases, as I mentioned, and autoimmune diseases. So you've got your rheumatoid arthritis, your irritable bowel syndrome, your other digestive orders, and high blood pressure as well. So it also can maintain sugar levels and prevent diabetes. Okay, so diabetes symptoms result from a lack of insulin and inadequate insulin in the body. And this increases your insulin resistance. So according to research, calcium is necessary for insulin secretion. And vitamin D benefits promote calcium absorption and utilization in the body. Okay, so therefore it contributes to the regulation of your insulin secretion. There is mounting evidence for low vitamin D levels in relation to diabetes. Okay, so vitamin D may also help you prevent against cancer. So, you've got risks of increased cancer development if your vitamin D levels are low. So researchers have found this association with vitamin D and cancer. So particularly the risk of breast cancer and colon cancers, ovarian cancers, due to the role of vitamin D's cell-life cycle and its ability to block excess estrogen. So it can help prevent estrogen-fueled cancers, such as breast cancer. the clinical nutrition research has proved that vitamin D and calcium nutritional status reduces the risk of cancer in postmenopausal women as well. I'm just reading a little bit to the side of this because I don't want to miss any of this important information. So research, as soon as 2018, they were researching this, and they found that in postmenopausal women, those women that had their vitamin D levels optimized they only had 1/5 of the potential to get cancer than the women who didn't have their vitamin D levels boosted. So it's really, really important to have your vitamin D levels up. Okay. I know I take a supplement called Complete D, which also has vitamin E, magnesium and zinc. So it's really guarding my immune system well. So the other thing it can do is help against heart disease. So vitamin D helps the heart by the maintenance of your normal blood pressure, as I mentioned, hypertension before. So there's a growing number of research material around that does support the fact that low vitamin D levels are linked to increased cardiovascular disease. So it's very important for your heart as well to keep your vitamin D up. It's good for regulating blood pressure, as I mentioned, cholesterol levels, and also reducing inflammation. Okay, another thing it does is facilitate hormone regulation, and it can even help improve your mood. So because it acts like a hormone in the body, it can affect your brain function. So having low vitamin D deficiency can be linked also to low moods, including depression. And sometimes people have seasonal mood disorders. So if you keep your vitamin D levels up, you can guard against that, including insomnia and PMS and anxiety. They're all symptoms of low vitamin D as well. So low levels can also interfere with proper testosterone and estrogen production, so leading to imbalances that can result in many unwanted symptoms down the track. So vitamin D also helps with concentration, learning, and memory. So we're really dissecting this little vitamin today, and I'm going right through everything, so stay with me. So several studies have shown that vitamin D affects our ability to make decisions, okay, to concentrate and retain our memory. So research has also indicated that that people perform poorly with their memory in examinations and so forth when they have low levels of vitamin D. They have poor decision-making skills and have difficulty getting their heads around different tasks, particularly around focus and attention. So you can see how it's really important and affects our whole body to have these vitamin D levels up. So there's also been a correlation of lack of vitamin D with the onset of schizophrenia, developing schizophrenia and multiple sclerosis as well. So vitamin D supports our skin health. So why is vitamin D good for the skin? It supports your immune system, controlling inflammation, which helps with skin cell growth, repair, and metabolism. So having adequate vitamins D levels will help guard against your skin aging, and it will reduce redness, dryness, other symptoms. So it also promotes weight loss. So weight management can be one of the main uses of vitamin D, makes it very, very popular. Some research suggests that supplementing with vitamin D will enhance your weight loss and fat burning. So that's another great reason to have your vitamin D levels up. So yeah, it's a great all-rounder and affects your body, so many different areas of your body. So let's look at maybe some signs of deficiency that you might see out there or for yourself with the vitamin D deficiencies. These can cause fatigue, so you'll get tired with low vitamin D. As I mentioned before, osteoporosis, bone fractures, susceptibility to infectious diseases, higher risk of cardio disease and high blood pressure. There's certain risks of cancer, certain types of cancer, autoimmune diseases, disorders, depression, insomnia, arthritis, higher risk for diabetes, asthma, chronic pain, skin issues, and developmental problems in children and infants. So let's have a look also now at the causes of vitamin D deficiency and the risk factors that make a low status in this vitamin more likely. So first of all, number one is lack of sunlight exposure. So the frequent use of sunscreens, as I mentioned before, underlying health conditions such as obesity, type 2 diabetes, insulin resistance, and hypertension. Okay, these can all lower your vitamin D absorption. Having darker skin, being over the age of 70 where your body doesn't process things as efficiently as it used to. Certain occupations, if you're in an occupation that has you totally indoors all the time. So what about radiographers, radiologists that taking x-rays in dark rooms all the time? Those people would really be susceptible to low vitamin Ds. Being a nursing home resident or a nurse inside hospital, also having celiac disease, Crohn's disease, or cystic fibrosis interferes also with the absorption of processing your vitamin D in the intestines and kidneys and liver. Okay, so let's have a look now at how to get more in your diet. Well, first of all, as I said, sunlight. Okay, 10 to 30 minutes a day. Okay. In addition to this, there are certain foods that will help you with your vitamin D levels, okay? And these are all your fish oils, so your cod liver oils and your, your oily fish that you eat. I don't personally eat fish, so I have to get my vitamin D source from somewhere else. I spend a lot of time outdoors here where I live because I have small acreage with lots of animals that need my attention outdoors. I have a fruit orchard and veggie patch and so on, so I'm always outdoors a lot. So let's have a look at some foods. We've got raw milk, butter, caviar, we've got eggs, in particular egg yolk, tuna, salmon, some sprouted seeds. If you've got any seeds that sprout, you just soak them in water and they'll sprout, or you can get sprouted breads and things like that. So your fortified dairy and milk products also can have vitamin D in it. And also mushrooms are a good source of your vitamin D, particularly the portobello mushrooms and the maitake mushrooms. So they're a good source of vitamin D. Also, now if you choose to take supplements, be sure to stick to the dosage, the correct dosage that's listed on the bottle, okay? But the people who shouldn't take vitamin D supplements, the ones who take certain prescription drugs, okay? And so I want you to always check with your doctor, healthcare provider, naturopath, as I am a naturopath. So those people on steroids, epilepsy drugs, such as phenobarbital and phenytoin, and people who are on diabetes drugs, blood pressure drugs, seizure medication. So just be careful. Corticosteroids such as prednisone, just don't take your vitamin D unless you consult someone first, okay? So if you have health conditions such as inflammatory bowel disease, liver or kidney disease, or hypercalcemia, then make sure that you go and talk to a healthcare provider, as I mentioned, because you perhaps should not take vitamin D just at this moment. So make sure you always consult someone. Vitamin D, excess vitamin D can also help look at perfecting your thyroid with hyperparathyroidism. So you have to be really careful there too. So don't just go out and go, I'm going to go on vitamin D. If you have any of these conditions, please consult someone before you go and take supplements and so forth. Okay, so let's have a brief look at vaccinations and COVID COVID-19 and the research that's been done around that. So whether you choose to have a vaccination or whether you don't choose not to have a vaccination, and then you don't have any of those conditions, top up your vitamin D, because researchers have highlighted nutrition as a possible factor as influencing the effectiveness of the COVID-19 vaccination, and also the resistance and how you're going to cope with COVID-19 should you be unfortunate enough to contract it. So they've established that there is a link between vitamin D levels and an adequate immune response. Okay, so there has to be a review, there's health reviews that emphasises the importance of a healthy diet, particularly a plant-based diet, one that that has high antioxidants and high fibre, to bolster your immune response to a vaccine. Okay, the reviews that I've read also introduces another powerful factor to this whole immune response, is that your healthy gut biome. So you really need to get your gut right, because remember, everything starts in the gut. So if you have a healthy gut, then you're already going to be more resistant to diseases and autoimmune disorders, and also viruses. So, and having a healthy gut is going to also be influential in your vaccine response if you have it. So as a primary example, a dietary fiber intake promotes a great abundance of bacteria like bifidobacteria in your gut, and that produces short-chain fatty acids, which can boost your antibody response in your system with your COVID vaccination. Okay, so the other important mineral that to add in there, as I mentioned it before, was zinc. So it's also been trialled to increase vaccine responsiveness. So if you do have the vaccine, look at your vitamin D and look at your zinc, and also your vitamin C, of course. So D, C, zinc, and vitamin E is in there as well, and selenium. They're your two antioxidants, E and selenium. So have a look at topping those up as well. So that's it for me for Cuppa Courage Tips, and we learned all about vitamin D, and I shall see you next week when I do my next Facebook Live here. So that's it for me, Leanne Boyd from Fearlessly Free Women. Have a great week ahead and see you then. Bye-bye.